Good afternoon, everyone, and thank you for logging in to the fourth and final webinar on the 2-in-1 Winter webinar series. I'm super excited to introduce Heather Spada, who is our Suicide Prevention Systems Manager right here at United Way of Connecticut. My name is Annie Scully, and I work in our Community Results Center. And today, Heather is going to talk about Connecticut activities around suicide prevention. Just so that everyone knows, a few housekeeping items. You're in listen-only mode this afternoon, so you won't have the opportunity to speak during the webinar. At the end of the presentation, Heather's going to provide her contact information, so should you have questions, feel free to reach out to her at any time with follow-up questions. This webinar is also being recorded. It will be made available on our 2in1ct.org website on the training and outreach page. You'll also all receive a copy of this recording and the slideshow presentation via email after the presentation. So thank you again for logging in, and I'm going to go ahead and turn the mic over to Heather.
Thanks, Annie. Good afternoon, everyone. Thank you for being here on a Monday afternoon, and it's so sunny out. I'm glad you can take time to join in. As Annie said, my name is Heather, and I've been working here at United Way for 5 years in the capacity of providing project management / program management support to federal grants that have come into a variety of Connecticut state offices. And the one I've been currently working on as the one of the program managers is this particular grant that I will talk about. And you can see it here in this slide. It is the Connecticut Networks of Care for Suicide Prevention Initiatives. I'll talk a little bit more about that as we move forward. But what I did is I just copied and pasted on this first slide what we sent to you as far as what was going to be outlined today. So I'm going to talk about an overview of what is happening predominantly in the statewide realm of these activities that are focused on youth and young adults. This particular grant, in this particular grant, the focus or the audience who is to receive the services are children age 10 up to young adults age 24, which is such a wide breadth of individuals. And so we've tried to provide certain activities to make sure on some level that all these individuals are being touched in some way, or at least have the opportunity to receive. I'm also going to talk a little bit about the Connecticut Suicide Advisory Board and its suicide prevention campaign. If you have not heard of it yet, you are going to certainly hear about it today, and I will give you information so you can connect to the wealth of information that you can avail yourself to with the Connecticut Suicide Advisory Board and campaign. So what we're going to do today is look through these main bullet points, and then of course there's always sub-bullet points. The first one, I just want to start in talking about the Suicide Advisory Board, our state plan and goals, just because the Suicide Advisory Board itself provides oversight to this grant and the activities that are happening. So I want to start there, and I will show you a slide coming up that really shows more of a mapping of not only the activities, but how is the Suicide Advisory Board related to these suicide prevention activities through the networks of care for suicide prevention. And in that, when we get to that portion, I want to particularly highlight the regional suicide advisory coalitions that we have been forming from the ground up and are continuing to develop. And we have some sustainability planning in place before the grant funding ends, which is probably the best time to do it is before the funding ends. So I'll talk about that. I want to highlight some of the young adult activities that are currently happening in the state and are also being formed. And then I will outline our school systems mini grants that we were able to award to 20 school systems in our state. The Connecticut Suicide Advisory Board, I know you can read this slide, but I'm just going to highlight a few things. The Suicide Advisory Board has been in existence for several years now, and they meet once a month, the second Thursday of every month, and they meet in Middletown at the Armed Forces Reserve Center on Smith Street. And I will give you, again, information regarding that a little bit later in the presentation. But these monthly meetings are open to anybody, and the board has certainly a large membership. And as we come together to meet every month, certain topics are discussed. There are a variety of presentations, And also the Suicide Advisory Board has, I believe it is 7 subcommittees right now that are actively working in different areas to not only provide information, but also to gather resources and provide an expertise to the state itself, and then also back to the advisory board. Some examples of that are there's a data and surveillance subcommittee, there is a lethal means reduction and awareness subcommittee. There's also a subcommittee that is looking at postvention resources and protocol, et cetera. So there's, like I said, there's a wide variety. That information is also posted on the Suicide Advisory Board website. You can see the mission and the vision, and many activities fall under what the advisory board does. One activity that was completed 5 years ago was our state suicide prevention plan. When you receive these slides, you should be able to click on the title as it is underlined, and that is hyperlinked to the actual plan. The plan is also available online on the website that, again, I will give you toward the end of the presentation. But Connecticut has a suicide prevention plan, and this is really guiding the work of suicide prevention activities through the Suicide Advisory Board, but also through any of the federal and statewide grants that have come through regarding suicide prevention, and certainly the one that I will be discussing today and the activities that are unfolding across the state. And with the Connecticut Initiatives Grant, we are looking predominantly in Goal 1 is to integrate and coordinate suicide prevention activities across multiple sectors and settings. And that has been kind of a driving force for us to help to meet that goal. There are plans, since this plan is ending in 2020, we are doing a review of the plan, we meaning the Suicide Advisory Board and some core groups around that, and then looking to providing an update to these goals and seeing where can these goals be enhanced to continue this plan as a guiding document. I mentioned a grant or an initiative, and this is what I'm going to talk about in order to provide a really good foundation for the activities I will then discuss. So the Connecticut Networks of Care for Suicide Prevention Initiative 2015 to 2020, that is a mouthful. What this grant is a federal grant that has come from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. SAMHSA provides a grant or offers a grant to state offices, and on the federal level, it's called the Garrett Lee Smith Youth Suicide Prevention Grant. So you may have heard it called that, or the GLS grant is sometimes called that. We entitled it what you're looking at right now, the Networks of Care for Suicide Prevention Initiative, but it is that grant that is providing the funding. And you can see here the overall purpose is to reduce non-fatal suicide attempts and suicide deaths among at-risk youth and young adults aged 10 to 24 in Connecticut. And so with that, that goal, like I had mentioned before, is we're looking to strengthen the capacity that we have in this state and the infrastructure that is already there to do these things, to be more supportive of mental health promotion, which we know that that's a really good suicide prevention piece, is to promote mental health from the little ones up to the young adults and certainly older than that. We're looking at suicide prevention and then the intervention component and response, which response has to do with any postvention or crisis type of response when there is either a suicide attempt that is severe or a suicide attempt that someone does find out about and want to provide help. And also if someone does die by suicide, there is a very healthy protocol in postvention that can be implemented and that can help to mitigate any further suicide attempts, or also it can also help to provide wonderful and very supportive grief support and attention to a community, a family, a school system, et cetera, that has experienced that loss that is unlike any other. And then you can see our primary objective here. And I want to mention a few things with the objective. Is that there is a statewide network of care. So that's what I'm highlighting today, is the statewide activities informing an overall network of care. And the predominant, I would say, organizing entity for that, and that provides the best venue for this to happen, is the Connecticut Suicide Advisory Board, so the statewide network of care. This includes the Suicide Advisory Board, and then 5 regional networks of care that I will highlight in a little bit. And those are those suicide advisory coalitions I mentioned. We changed the name of it, and I'll explain why when we get to that slide. So that's the regional work that's happening statewide. And then there is one community network of care that I will mention and highlight. I will not describe in detail, but I can provide you more information if you would like it. This is happening in the town of Manchester through Community Health Resources. And I have a colleague there who provides the program manager role through that. And they also have some intensive data collection as well. So that is what the CNC is referring to. This goal too refers more to Community Health Resources and the CNC I just mentioned in the previous slide that the town of Manchester is providing through Community Health Resources. And they are doing a phenomenal job in trying to integrate and coordinate and collaborate, right? Those words that we like to use and hopefully are able to do within this one town. And it's happening through, as you can see, the partners here, Community Health Resources, National Suicide Prevention Lifeline Provider, United Way of Connecticut, which is here at my office, Manchester Public Schools, the Police Department, Manchester Community College, Eastern Connecticut Health Network, and then other providers are coming in as they are moving forward, and they are doing a fabulous job. This is an organizational chart that I would like to just, again, mention, and I'll show it to you. You will get this so you can look at it in detail if you would like to. In order just to kind of lay out, this is what's going on and how we're trying to organize these pieces. As you can see, the Suicide Advisory Board is providing the state plan as a guidance document, as well as advisory for GLS, which again stands for Garrett Lee Smith Suicide Prevention Grant, is the federal title for this networks of care. And one thing I didn't mention at the beginning is who are the state offices that receive that grant. So we have the Connecticut Department of Public Health, the Connecticut Department of Mental Health and Addiction Services, and the Connecticut Department of Children and Families. These 3 offices and entities are working together as co-project directors, and the Connecticut Department of Mental Health and Addiction Services is providing the main focus and direction and guidance, kind of the point person as a principal investigator, and we do go through DEMIS for many things, and have our meetings primarily here, although DPH and DCF are very much involved, especially as their offices can lend the specific weight and data and information and support, again, for our children, right, and families for DCF, and the public health piece, which is just so key as we're looking to reach out across our entire state through all those entities in order to enhance suicide prevention and make sure communities are feeling supported and that they have the information and training that they need. We are being evaluated, all of our work, and those of you who work on grants, you know there's evaluations and data that have to be collected. UConn Health is doing that for us. And then this is me. These are the regional coalitions that I will talk about in detail in further slides. And then right here is where Community Health Resources, our intensive community-based CNC, is connected. So we all are in some way and lending information, especially to one another. We are utilizing regarding for data purposes and for meeting purposes and organizational purposes. We are using the 5 regions that are identified by the Department of Mental Health and Addiction Services. And as opposed to, I think DCF has 6, we're utilizing these 5. So anyone who is part of these regions here for Region 6 for DCF, they just kind of split depending on the towns that they are involved in. So this slide, I debated putting it in, but as you can see, I decided to do it. And one major reason is that these websites are so good as far as information that you may like to look at further once you receive these slides. If you have never visited this website, this is the Suicide Prevention Resource Center, and there is a plethora of very valuable resources for suicide prevention. And also there are online trainings that are very good and that you would be able to avail yourself of those things, as well as you know, handouts, brief material, as well as much larger composites of material as well. And then for SAMHSA, again, the Substance Abuse and Mental Health Services Administration, their website itself is very helpful when you're looking at not only suicide prevention, but also mental health information. But we're utilizing these two components in order to give a framework for the work that we are doing in looking at a comprehensive approach to preventing suicide. And these 9 pieces are something that we are looking at in each of the regions, as well as for the school systems that are part of the work that we're doing, which I will talk about in a little bit. We are also working with them in these 9 areas as they're designing their action plans to really evaluate their systems and see, do they have pieces in place for these 9 areas? And if not, how can they plan to bulk up, you know, whatever is missing in there? And with this framework here on the left, really, and you may have gone through the SPIF model yourself, but you know, this is just what we're using as a guidance document in order to look at our processes, and to start with assessing what is there, evaluating capacity, then doing planning based on these 2 pieces, implementing it, and then seeing, is it working? And if it's not, how can we, again, do an assessment to figure out why it didn't work, and then you go through the process again. So I just wanted to leave this here for you to see, and you may want to learn more about the SPIF model itself. It's a very effective model, and there's actually training here on this website for it if you'd like to learn more. So this next section is regarding the Suicide Advisory Coalitions. And they have kind of morphed, and I mean that in a good way, from the beginning when we were looking at how can we begin to form these networks of individuals that work in a variety of capacities and agencies, from the police department to public health, school systems, local prevention councils, the hospitals, etc. And really, you know, and also mental health clinics, child guidance clinics, those who interface and provide services and also data and resources regarding that age group that I mentioned, the 10 to 24-year-olds. So what we did is we provided a gaps analysis to those 15 organizations that I didn't mention all 15, but that type of organization. We did a gaps analysis in each region, and then we presented to these regions in kickoff meetings in the fall of 2017. And in each region, we were able to gather together, provide, usually it was a breakfast meeting, and to show them just regional data as well as statewide and national data that would really help to support some kind of coalition forming and being able to then address those gaps that are in those regions regarding suicide prevention, intervention, and response, as well as mental health promotion. Those meetings were really good, and we gathered more information at those as well. So after that, we began meeting quarterly in each region, and the member organizations currently include these that you can see here, and there's probably more that I forgot, and I apologize for that. But what we're seeing is that certain folks are continuing to come, and they're also inviting others from other entities. And I just want to clarify what these mean here. So Beacon Health Options is here in Rocky Hill. They certainly are a nationwide organization. But through a Connect grant through the Department of Children and Families, they do have regional network of care managers who, you know, one of their main expertise is forming systems and being able to really do regional work. So they've been very informative in the regions that they cover. This is Favor Family Service Managers. Yeah, similar work, but it's with families and children. And FAVOR is a family advocacy group an organization that is in our state. And then NAMI Connecticut, NAMI is a National Alliance on Mental Illness, and they have, again, wonderful programs throughout the state. I will highlight NAMI Connecticut in a little while because they are specifically partnering with us to reach out to the young adult population. So many of our agenda themes, excuse me, at least through this first year, have been on focusing on coalition forming, which does take time and it goes through a process. So we're working on those steps and getting to know each other. A lot of time is spent on sharing resources and connecting individuals to other individuals who can give specific resources or partnering or help, whether it's for events or for certain situations. We also share data needs, bring data to the table, review and talk about how can that help to reach and to, excuse me, fill the gaps that might be there. We review the STRC framework, which I showed you in this previous slide, and then we're leading toward action planning. So all of this has to happen first. We really are in the forming stages, but regular people are attending. Guests are always invited. We've had some speakers come in, and there's a lot of collaboration and really networking that is happening, and we've all been really pleased in what's going on in each of the regions in that way. So what we've been doing as well is, like I'd mentioned, the gaps that are there in each region. So as the coalitions have been meeting, that is something that we look at is, you know, just as people who are working and living in those regions, what would they say are the gaps to explore as potential action planning steps? And as I, as I attend and help to host each one of these meetings, these are the common themes really through each of the regions. We're looking at this, wanting more specific data regarding hospitalizations and suicide attempts, especially through the teen and young adults, like what is happening there. There are training gaps regarding intervention, very solid intervention protocol and training, so adults feel that they are equipped to do what they need to do. And also the response protocol, right? And like I'd mentioned before, and looking at more post-vention team training, that there is a very solid plan in place. People know who to contact, what their role is, what the process is, etc. And another one is looking at the access to services and that no wrong door philosophy that, you know, whoever needs help, whether it is a child, a teen, a young adult, the parent of a child, teen, or young adult, etc., if they are needing services, that whoever in that system that they contact, even if that person, him or herself, can't help, they will know who to get them to, right? Or how to get them to the next step, to then get them to who they need to talk to or the help they need. Another gap we're seeing is that communication with emergency departments, and to outline that a little bit more is when a family of usually it would be a school age or a teen is going to the emergency department because they are having either they're talking about wanting to either hurt themselves or kill themselves, or they are emotionally just not able to stay at school. They might sometimes get sent to the emergency room. It kind of can fall apart there. Either they wait very long or the evaluation takes a long time, or parents just don't know what to ask or what the process is, what their rights are, what the next step should be, those kinds of things. And then if it's the child or teen or young adult child or teen coming back to school, what kind of policy and protocols should be in place for a very effective and supportive reentry right after that happens. And so we're trying to figure out what can some pieces be put in place to have enhanced communication and supportive communication with emergency departments. And then the last piece that we're seeing, or another gap, is how to do effective outreach and engagement with community and parents, other than holding meetings and events, knowing that, again, the way people's schedules are nowadays, it can be very hard to add one more thing. So we've been talking and exploring that too, whether it's through media or really finding out what are other meetings that are happening that we can dovetail into, etc. And I had mentioned at the beginning of the call that we are already talking about sustainability of these regional coalitions because the grant is ending, the overall federal grant is ending September 2020. So we'd like to have this in place and start to get moving in that direction. So to that end, we have met, well, as of tomorrow, so this is a little ahead of time, but as of tomorrow, we will have 3 meetings to date, but we're calling Coalition Sustainability meetings. And so we're meeting at Beacon Health Options with these entities and these organizations. And so Beacon is, again, they're working through DCF for the network of care. Favor is also, they're working through DCF through their support and funding and direction, because they are working with children and families, and they also do regional work. The regional behavioral health action organizations are being funded through the Department of Mental Health and Addiction Services, and their primary charge really is in the area of prevention and community support in their region. These are very key organizations and individuals. And then these directors, Andrea Duarte, Kim Marshall, this is from DEMIS, from DCF. Also Susan Logan, I forgot to put her on here. She is from the Department of Public Health. And then I am there as well to help to provide not only knowledge and information from the meetings, but also to be able to take that back to the coalition meeting. So what we're looking to do is to integrate and sustain within these service systems that are already happening. And so that would be through these 3 systems here. There are many, many meetings that people already attend, which if I could see you all, you'd be nodding your heads right now. And we don't want to add another, but is there a way to integrate into what's existing? There are some systems that already have a natural fit that we're looking to kind of transfer that over and for them to continue the work. So we're going to work on those specific planning steps. So, and ideally for fall of this year, to be able to do that, and more details to come. Some other avenues for sustainability is we're making sure that these coalitions have representation in the monthly Suicide Advisory Board meetings, that they're on the agenda so they can provide regional updates. Right now, I'm the one that's doing that, but that will, again, as this develops and there's more ownership is taken, and as the sustainability happens, this will certainly grow in that area too. And then what we would like to do is put the coalition meetings on the calendar for the Suicide Advisory Board and the state suicide prevention website as well. Okay, so next slide. I want to briefly mention or highlight the young adult outreach, because we are, just so thrilled to be able to partner with the National Alliance on Mental Illness, or NAMI Connecticut. And one thing that we saw in the grant deliverables is the challenge of reaching young adults, because none of us working on the grant, I don't think, are young adults. So we said we need to partner with young adults in order to reach young adults and figure out, where do we go and how do we reach out to them and provide support, and also opportunity for them to be part of the solution and to reach out to their peers if they're not in college. Colleges have an opportunity, and there are some colleges in our state that apply for the same grant, but it is a college, it's called the College Garrett Lee Smith Youth Suicide Prevention Grant. So they're working on that. We do interface with them, but as part of this statewide grant, we are looking to reach out to those young adults who are not affiliated with the school. They may be in the workplace, they may be in training programs, or maybe they're just trying to find out where they fit in, that kind of thing. So in saying that, we subcontracted with NAMI Connecticut with their young adult coordinator, and she is really phenomenal in the work that she does. And in particular, they already have existing young adult connection groups throughout the state. And these are led by young adults, and they are for young adults. And these connection groups are for any young adult that is looking for support regarding their mental illness. If they have someone in their life that's close to them that has a mental illness, and that they're looking for support regarding that, and just they meet regularly and are able to connect together in that way. So what we did for these connection groups is we infused suicide prevention materials into their existing training document for their connection group facilitators. And also, we trained this young adult coordinator in Question, Persuade, Refer, or called QPR. Some of you may be familiar with that. That is a gatekeeper training. It is evidence-based practice on training anybody to be able to feel more equipped regarding helping someone who may be feeling suicidal, who may even just be in an emotional crisis, to help them get to the help that they need. So we trained the young adult coordinator to be a trainer, and now she trains the young adult connection group facilitators in QPR, so they are more aware and they feel more equipped to help if anyone in their group seems to be in distress, so they would know what to do and feel much more supported in their skills to be able to do that. And also in this facilitator training, I have helped to provide some of those QPR trainings and to support around that, and help to provide some activities that are needed. And now they're kind of on their own. And now the suicide prevention training, I would say, is fully embedded into what they do. And the young adult coordinator is also developing a training of trainers for these facilitators. So she can be freed up to do some other work too. So she's taking a lot of initiative. Another piece that we did is we partnered with the American Foundation for Suicide Prevention. Some of you may be aware of that. That is AFSP.org, with their Connecticut chapter, to host a training of trainers for suicide loss survivors who are either youth or young adult. And so so she was trained, and a few other folks were trained on this, so that they can begin to hold support groups for young adults who have been affected by suicide of a loved one in their life, and they need that survivor support. There are many groups in our state that are in existence, but they focus on adults, and so we wanted to bring this same support to the young adults. And I think 2 groups have started, and our goal is to have at least 5, 1 in each region, and certainly if more develop, right, the more the better. Now from this training, a grief coalition started to form from all those who were trained on that model, and they kind of grassroots are forming a grief coalition that does span the lifespan, so it's not just for youth and young adults. It's not something that we are directly sponsoring, but we are certainly in support of that, and are very glad that that this will help to address something that is very often not talked about, are those who are a suicide loss survivor. The grief process and the grief that is there and the loss that is felt is often unaddressed, or addressed very quickly at the beginning and then not after. And there's a unique element of grief when your loved one has died by suicide. And so they're looking to help to, again, fill that gap with not only support, but information and good research and good training. So, so more to come on that as they develop. They are brand new. And then the last piece I want to highlight is that NAMI Connecticut is partnering with Advocacy Unlimited, and they are located in New Britain because we also saw another gap for peer-to-peer groups for young adults in the area of for young adults who are often have suicidal thoughts, and they want to find support around that. What do they do with that? And there is a training and also a group model that's called Alternatives to Suicide. And so our coordinator plus a few of the Advocacy Unlimited staff there are being trained in this, and they're going to partner together to kind of pilot a group through Advocacy Unlimited, and then see where to go from there. So they're going to be trained in April. And they're looking to form the group starting in the summer, and they're going to try it for a year and see how that develops and where to go from there. This is our young adult outreach, and more to come on that as they continue their work. And then the last element I wanted to highlight of the activities that are happening in our state regarding youth and young adult suicide prevention are our Connecticut Regional Networks of Care for School Systems. And there are many grants, although they're not so many because the work that they're doing is pretty big. But we wanted to, in some way, provide school systems in partnership with community organizations, predominantly either the youth service bureaus or the human services organizations, the local prevention councils, et cetera, to partner together in order to do more pinpointed suicide awareness, prevention, and that type of thing in the school system. So we did the request for proposals last year. 21 systems applied and were accepted, and then 20 entered into the 2-year contract. So, so these mini grants are from September 2018 to July 2020. And I will show you here in a little bit the schools and also the organizations that were awarded. One of the main reasons we decided to go the route of these school system mini grants is looking at the Connecticut School Health Survey of 2017. And just if you look at these statistics, if you look at the percentages, especially right, the sad and hopeless, it's heartbreaking. And also, you know, if you look at the adult support rate, 31% of high school students reported that they could not identify even one teacher or other adult in their school to talk to if they have a problem. That's huge, right? Well, almost 1 in 3. And then as far as getting the help that they need when feeling these emotions here, about 1 in 4 say that most of the time or always, right, to get the help that they need. So we want to increase that. And we want to address these pieces. This is the additional part of this, and you may have seen this survey already. As far as looking at inflicted self-injury, almost 1 in 5 of students did something purposely to hurt themselves, right? And so how many more did not report that is something that I think about sometimes. Those that seriously considered attempting suicide, almost 1 in 7. And then attempting suicide, almost 1 in 12. So as we looked at these, you know, we said, oh, right, can we support the schools more, support the staff? Can we encourage and highlight the importance of having trusted adults, and that students understand what trusted adults are and are encouraged to seek them out? So that's really the bottom line of these grants, these mini grants. So this is our state, as you know. I don't know why I said that, but this is our state, and these are our 20 grantees. And you can see where they're located with the heart. And then I'll show you the list later. And you know, we have a pretty good spread and representation throughout the state. Just not down in this area. And although our regional network of, our regional coalition is certainly doing support as much as they can with the school systems there. So this next two slides will show you the list of school system grantees. I'm just going to keep it up there so you can kind of look and see. And again, you will be sent these slides so you can look at them in more detail. What I did want to point out is that the fiduciary or the lead for these mini grants are either the public schools themselves or would be an organization like Clinton Human Services, and they're working in conjunction with the public school. And you'll see, even though majority is the school system itself as a fiduciary, there's a lot of partnership that is happening and different organizations taking the lead. And this is the remainder of our grantees. And they are working hard and doing very, very good work. So some of their responsibilities is they have to complete action plans that, that outline what their activities are in year 1 and then in year 2. And just to kind of refer back to the puzzle model that I showed you, those 9 areas of the comprehensive plan for suicide prevention, that is how their action plan is organized by those 9 different puzzle pieces or those 9 different types. And then they fill in, you know, how are they in their system going to set a goal and activities to help to meet that goal in those different areas. The first 3 or 4 months really was training trusted adults in their system and preparing their system for when they do bring certain curricula into the school, when they look to enhance their policies and procedures, et cetera, that that the adults in the system are trained. And I'll go through the training pieces in a little bit. And when I say trusted adults, right, that is everyone from the bus drivers to the school nurses to the secretaries and administrative assistants in the front office to the teachers to those who are serving food in the cafeteria. Whoever a child or student is going to talk to, and also informing parents of what is happening and encouraging parents to take part in what is going on. The grantees participate in monthly web meetings, sometimes every other month, but we stay in regular contact. We have yearly grant meetings and yearly site visits. We're completing those right now as we speak, and just to kind of go over how is this going, right? They're in the middle of year one, and talking about, are there roadblocks and how can we do problem solving? What are the things that you are so excited about that are going on right now because you have money to do the work you've been wanting to do, etc. And of course, there's regular reporting, right? We have to do quarterly reports, etc. And also we are doing a systematic evaluation through surveys of the curriculum that's being implemented, which I will highlight next. So these pieces here are what we are requiring our grantees to utilize in some capacity as they are doing their work. And these are all best practices, except the last one here, Gizmo's Possum Guide to Mental Health. That is evidence informed. We designed that based on the Brown and Stanley Safety Plan. And we are utilizing the mini grantees and their work to do an evaluation of this guide and the curriculum that's attached to it in order to be able to then take it and hopefully to make it more of an official evidence-based practice and to provide that curriculum or have it available, I should say, on the elementary school level. But let me highlight what each one of these is. The Columbia Suicide Severity Rating Scale, or the CSSRS, is a screening tool, and it also can be, there's a short form and a long form. We encouraging them to at least use the short form screener. And the ones who are utilizing this are, I would say, the kind of that second tier of support. So who a teacher would bring a child or a student to who is just either talking about harming themselves, maybe they're thinking about suicide, or maybe emotionally they're just, just so distraught they can't even put it into words. So whoever that student would go to is being trained on the CSSRS. So usually the school social worker, psychologist, counselor. And in the community, right, the community counseling folks, those at the local prevention council, those who are providing the mental health services to children and families. And also the safety plan. This is a Brown and Stanley safety plan. Like I said, we modified it for children when we designed this book and the curriculum. We're encouraging schools to do the same thing. It is set up for adults and as a safety plan, but we're encouraging them to utilize the same 5 elements, and they can even create more of a mental health check-in for students. They can individualize that plan for themselves, and schools are getting very creative and really coming up with some wonderful ways to utilize this plan. And for students to use it in a way to help support their mental health, and also to help them if they do feel like they need to talk to someone, they know exactly who they want to go to and have that set up. Looking at the strategic prevention and SPRC framework, that's that puzzle model, and the flower model that I showed you at the beginning. We are utilizing these elements. Question, Persuade, Refer is the suicide prevention, awareness and prevention gatekeeper training that all the grantees were trained as trainers. We provided training, 3 or 4 TOTs for them to send at least 2 to 3 people from their system to be trained as trainers. And then those individuals have been training their own school systems. And we have had hundreds and hundreds of people, professionals in the school, whether, again, they are the superintendent or the teachers or the support staff, whoever it is, have been trained in QPR. And so we're really, bulking up that infrastructure and have had really good reports back that that staff and teachers, especially on the elementary school level, have been thankful to receive some type of training in suicide awareness and prevention. So we're very glad for that. Now, those who are in the middle school and high school will be utilizing the Signs of Suicide, or SOS curriculum, suicide prevention curriculum for middle and high school. And then those in the elementary school, like I said, are piloting our Gizmo's Possum Guide to Mental Health book that comes with a set curriculum. That's a very brief 5-week curriculum, 5-segment curriculum that can either be finished in one classroom setting or spread out over maybe 5 classroom periods, and we're gathering information and evaluation information on that as they hold that. Then the last piece I want to mention, I've mentioned it actually before, but I want to highlight it even more, is a suicide prevention campaign. I put the logo up here. Hopefully you have seen that in many places. Sometimes on a billboard, you might have heard commercials, whether it's Department of Public Health has funded the commercials or the billboards or whatever organization, but it's really highlighting that there is a website that folks can go to, and it's the preventsuicidect.org. And on that website, all this information is there. The Suicide Advisory Board meeting information, there's the minutes and the agenda from meetings since they've happened, as well as any presenter information. There's also, there's also a way to, at the very top of the banner, once you go on the website, go to the right and you can sign up to be on the listserv. And it is a very good resource. It's not an obnoxious listserv where you get emails every day, but it will alert you when the next monthly meeting's happening. It will give you the agenda and the topic, as well as if there's any trainings or events related to suicide prevention happening in the state that you may be able to avail yourself of. So I would encourage you to be a part of that. There's also many, many resources. If you just go to the resources tab, you will see, and it's for all, I'd say all stages of life. If they're specific for school age or adults or children or whatever system that you are in, there's resources that are free. Either they're downloadable documents or they will link you to other organizations. And there's also training links as well for the CSSRS that I mentioned in the previous slide, and so many others. And most of them are free, and you can do them right there. There's also free materials if you would like brochures or bracelets or pens or the giveaways, stress balls, that kind of thing. There's posters, etc. The materials, sometimes they change. We try to do some new things here and there. Sometimes things are given away, so we have to wait and order more. But I encourage you to go on there and order some things for your organization that you can hand out and look at yourself, and they can really help you in your work. And also, as you know, about dialing 211, that is part of the National Suicide Prevention Lifeline. If you call 211 and you press 1 for a crisis, someone will help that individual. So if you're not sure what else to do, right, as far as if someone is in crisis, you can sit with them and call 211. They can certainly be triaged there, and next steps can be given. You can also call the National Suicide Prevention Lifeline, which again also helps to provide very, very needed support right away. And then finally on the website, there are links to other suicide prevention organizations. Like I mentioned, the American Foundation for Suicide Prevention is a wonderful resource if you want materials, especially in the postvention or looking at response. They provide really good materials around that too. And in conclusion, you sat and listened to me for 45 minutes, so I congratulate you. And I hope this has at least given you some information about what the good things that are happening in our state by a lot of different people. And we're really trying our best to raise awareness regarding suicide, also regarding information where people can not only receive help, but also receive training and support around suicide. And the more we talk about it in a supportive way, we can reduce the stigma, which is key. This is my contact information. And again, you'll be sent this. So feel free to email me or call me if you would like to either join, if you want more information about the coalitions. I can send you information for whatever's in your region or anything else. Also, there is the link for the Suicide Advisory Board and Prevention Campaign. And then if you want to learn more about Gizmo, and that is our elementary school kind of age information that we've been working on, there's his website right there. And again, if you have any questions, please let me know. Thank you so much for your time, and I wish you a good day and a very good rest of your week. Thank you.